Pitchside Assessment has developed over the past few years. However, a mainstay of the assessment has been the so-called Maddox Questions, a simple set of 5 questions there to help you determine whether somebody has a suspected concussion. Gordon, where are we at? What venue are we at today?
We're at BT Murrayfield.
That's correct. Which half is it?
First half.
Do you remember who scored last?
Japan scored last.
Who did you play last week?
We played Japan as well.
Who won the game last week?
Scotland won the game.
That's correct. The Maddox Questions can be found on a document called SCAT3, Sports Concussion Assessment Tool. This tool is designed to help you make the diagnosis of concussion. It doesn't necessarily make the diagnosis of concussion. The SCAT3 contains a number of other questions and another number of simple measures that you can use to assess the player. One method of assessment may be that of short-term memory. Gordon, I'm going to ask you, or I'm going to tell you a number of items. I want you to recount them back to me in any order you like. Elbow, apple, carpet, saddle, bobble.
Elbow, apple, carpet, saddle, bobble.
That's correct. This can be repeated on a number of occasions. With the SCAT3, it's done on 3 occasions. You then may ask them to recall that list again at the end of the SCAT3 document. As part of the SCAT3, a number of balance tests may be performed. One of the most obvious is to ask the player to stand with the legs very slightly apart, put their hands on their hips, close their eyes, and maintain the balance for a period of 20 seconds. If they deviate from that position, they should open their eyes, regain the stance, and the time should continue. The number of errors, i.e. the number of times the player becomes unbalanced, is then recorded. Well done, Gordon. Open your eyes.